Well, May is prime time for proms and weddings. It's also Melanoma Awareness Month. In light of this, UConn Health Center dermatologist Dr. Hanspaul Makkar is here to talk to us about the dangers of tanning beds. Doctor, thanks for joining me.
Thanks for having me.
So let's start off by talking about your risk for melanoma. When I read this, I didn't believe it. It increases by 75% when you use tanning beds before the age of 35?
Absolutely. So especially in women who use tanning beds before the age of 35, they'll increase your risk by as much as 75%. But even tanning as infrequently as once a month can increase your risk as much as 55%.
Well, that makes sense, because some people say, well, I don't do it that often. I just do it sometimes if I have a wedding or something to go to, and you know, you don't want the tan line. So you're saying that even just that infrequently.
Absolutely, and it's not just melanoma we're talking about other skin cancers such as squamous cell carcinoma and basal cell carcinoma. So it certainly increases your risk for all these three major types of skin cancer.
Now, I had a friend, she had melanoma. She said she noticed something. I mean, you noticed something on your skin. What are you looking for? I think what are the signs, and what should you look for, and when should you call the doctor?
So some melanoma arise from no pre-existing skin lesion, and some arise from a mole that's changing.
Okay.
So any mole that we commonly teach patients to look for the A, B, C, D of melanoma. So if it's changing in color, in diameter, in the border, or if it becomes asymmetric, these are signs to watch for. If you have a sore that's not healing, that can be a sign of a skin cancer.
And what if, I mean, sometimes I would imagine a lot of people, they don't know every little mole and everything on their body. They're not really paying that much attention.
Absolutely. You know, the patient is your best advocate. So getting to know your body and then seeing your primary care doctor or your dermatologist is a really good tool to help detect skin cancer.
Okay, and this is interesting. The International Agency for Research on Cancer shifted indoor tanning devices to the highest cancer risk category.
So that's exactly right. In 2009, the World Health Organization determined that ultraviolet radiation is a class 1 carcinogen, meaning it causes cancer in humans. So we know that it's a real link, which is why it's so important to avoid risky behaviors like tanning beds.
Okay, so let's say you really want to get a little nice glow. Is spray tanning okay? I did that just a few days ago. Is that okay? I would assume that that's much safer than tanning outside or in a tanning bed.
Probably. As far as we know, self-tanners are probably safe. There's no such thing as a safe tan in terms of a tan that's induced by the sun or from a tanning bed. Self-tanners are probably okay. There was a time when the self-tanners would give you an orange glow, but that's not true anymore. So we'd prefer that over tans from a tanning bed.
And when people tan, you're saying this can be addictive. That's why people go so many times. Sometimes you see this orange glow and they think they're not tan enough. So you're saying that it can produce a drug-like effect, like a...
It's really interesting that we're thinking that tans are much like nicotine. It probably forms some sort of a chemical reaction that gets you to feel good in a way. And what we need to do is try and figure out what that chemical reaction is to help figure out how to stop this.
Okay, Dr. Makkar from UConn Health Center, thank you so much for joining me.
Thanks for having me.
Thank you for your time.